Next, the public health report that triggered the Leicester lockdown. It was published last night and reveals the key facts that saw the city plunged back into a strict form of lockdown and excluded from the new freedoms coming in on Saturday. It makes visible for the first time the dramatic wave of infections that has so alarmed government health officials. Here's our social affairs correspondent, Jeremy Ball.
Grim reading in this investigation from Public Health England. It's revealed why Leicester's raising so much concern. The smoking gun here, a graph which charts infections in the city. Before this report, we only had the data for cases in hospitals and care homes. Now, as you can see, those so-called Pillar 1 numbers were going down. But look at what happens after they added cases from community testing centres. You can see Leicester's numbers rising sharply, bucking the national trend. In all, 944 tests in the city have come back positive. This report says those people are from all communities, reflecting Leicester's ethnic mix, and their average age is just 40. That's 10 years younger than Leicester's nearest neighbours. Here's some reaction from Spinney Hills today.
Loads of people want to come out, they're getting confined to a house, everyone's getting frustrated. That's why I think people are not listening.
We've just about got used to being out of lockdown, and then to jump back into it straight away, it's just all like mind-blowing. I don't know what to do.
They mark the floor with 2 meter distance, but you go down to the grocery shops and there are about 20 people in a small shop.
And this new report's been looking at why Leicester's numbers are so high. One reason, they say, is the city's extra testing centres, because they're finding cases that might not have been identified otherwise. But this surge is very real, they say, because Leicester's infection rate is now 6 times higher than the national figure. And here's where people who tested positive live. The darker blue is parts of the city worst affected. Public Health England say that's prompted outbreaks at their workplaces right across the city. Food factories, supermarkets, nurseries too. And they're also looking at outbreaks in the city's textile industry.
I think that there is potentially something around some of the work and especially lower paid workers and some of the working conditions where people aren't getting more than statutory sick pay when to take time off. That doesn't incentivise people to keep to the rules. And obviously what we want to make sure is when people are sick with COVID or COVID symptoms, they are isolating and they are coming out of the workplace.
But it was COVID hospital admissions that finally convinced Leicester City Mayor to support the lockdown. Those numbers still aren't going down, and the report says one outbreak happened on a local hospital ward where 5 patients tested positive despite being clear when they were admitted.